I'm Supervisor Terra Lawson-Remer, and since I joined the Board of Supervisors in 2021, I've been fighting for local solutions to make healthcare, especially mental health care, affordable and accessible for everyone in our region. Implementing the 988 hotline 2 years ago made it even easier for residents in crisis across our county to access the services they need. Our mobile crisis response teams, MCRTs, are a local solution to mental health care. So today, we're here to update you on how our mobile crisis response teams are doing. And with me, I have Dr. Luke Bergman, the director of our County Behavioral Health Department. So before I get into the details of some of the successes, I want to talk a little bit about how MCRT works. It's an alternative to sending armed law enforcement for people who are experiencing a mental health episode. Over 98% of calls have been diverted from armed law enforcement response. And so when someone calls 911 or 988, the dispatcher goes through a series of questions to assess the situation. And in the case of a mental health episode, a mobile crisis response team can be dispatched anywhere in our county, a home, a business, a street location. And when they show up, these teams consist of a mental health clinician, a peer support specialist, which is usually someone with lived experience, and a case manager. And again, over 98% of calls have been diverted from armed law enforcement, resulting in a trained MCRT team arriving instead. So since 2021, when this was rolled out countywide, MCRT has responded to over 13,000 calls and served over 7,800 unique individuals. Of these 7,800 individuals served by the mobile crisis response teams, 12% have been young people under the age of 18, 16% have been over the age of 60, 72% live independently, and 18% are homeless or unhoused. And while clearing homeless encampments and moving people into shelters, tiny homes, and supervised safe camping sites is a top priority of mine, I want to remind folks that MCRT was not specifically designed as a program for our unhoused population. It's best used as a prevention method. It can actually lessen the chance that an individual ends up on our streets because it can help folks manage their conditions before they spiral downward to a darker place. So what's been going on with these MCRT transportations and calls? 20% of our mobile crisis response team interventions have been occurring in the North Coastal region, including my district, with an average response time of 17 minutes. Over 80% of our calls responded to are diverted from emergency rooms and hospitals. Over 50% of the calls are successfully resolved in the field, which means they don't need to be transported anywhere. And this really helps out the burden on our hospitals, our emergency rooms, and our law enforcement detention facilities. About 28% of the calls have been transported to our crisis stabilization units, and only about 12% require transportation to a higher level of care, like an emergency department. MCRT delivers trauma-informed care and uses community-based interventions to de-escalate situations, allowing folks to remain in the community. So if you or someone you know needs a mobile crisis response team, please dial 988. Now I'd like to introduce Dr. Luke Bergman, Director of our County of San Diego Behavioral Health Department. Since I joined the Board of Supervisors, Dr. Luke Bergman has met the moment with programs like MCRT and so many others. Our board has been working hard to put policies in place to ensure more is done to deliver mental health and addiction treatment services. And thanks to Dr. Bergman and his team, we are doing more and doing better. Our mobile crisis response teams are one of our shining examples of what policymakers and health experts can accomplish when we work together with our eyes focused on how to provide effective solutions for our community. So to talk more about the importance of having MCRTs in our community, please welcome Dr. Luke Bergman.
Is this okay? Thank you so much, Vice Chair Lawson-Remer, for your leadership and for being here to talk about this incredibly important initiative at the County of San Diego. A lot of what the Vice Chair just mentioned, I think, is important because it demonstrates that mobile crisis response teams are more than a feel-good story. The numbers behind this service make clear that it works, that it is significant at the population health level in the County of San Diego. And the upcoming year will present more milestones for San Diego County's signature Mobile Crisis Response Team program. With the new budget enacted for this fiscal year, we'll be sustaining a recent increase from 34 to 44 mobile crisis response teams. It's an incredible achievement, not just establishing something new to the county, but building it out to scale, geographically and around the clock. And these scale milestones are particularly significant in light of massive changes to state policy over the last year, like reforms to the laws that define 5150 holds, dramatically expanding involuntary detainment and transport for treatment, which MCRTs are designated to do. But MCRT is not just about responding to crisis when things have already hit a kind of bottom. MCRT is about access, about prevention, in the Vice Chair's language, access to care and making mental health care and response a normal part of our clinical continuum, and as accessible or more accessible than health care for any physical health malady. MCRT reaches you where you are. And MCRT is about understanding mental health as primarily a healthcare rather than a law enforcement issue, and as something grounded in patients' rights and in an understanding of how traditional responses to mental health care have often further traumatized those we are seeking to help. MCRT is the leading wave of broader efforts to make mental health care and behavioral health care generally truly more recovery-oriented, trauma-informed, and human-centered. Thank you so much.
Thank you. Once again, I just want to give a little bit more background on the mobile crisis response teams because they're so important as a prevention method for folks that are experiencing a mental health crisis. And it can lessen the opportunities or the chances that an individual may experience homelessness because it can help folks manage their conditions before they end up on the streets. Our mobile crisis response teams deliver trauma-informed care and utilize community-based interventions to de-escalate situations and allow clients to remain in the community. MCRTs are a local solution to mental health care. If you or someone you know needs an MCRT, please dial 988, and we are happy to take any additional questions. Thank you.